whether somebody has major medical insurance or somebody has Medicare and Medicare supplement or Medicare Advantage insurance, all of our programs fill gaps that are left by all of those different coverages, whether it's major medical and they're only 61, whether it's a medical insurance that's put on and offered through their pension system, whether it's something that they bought outside of everything else, or whether they have Medicare and a Medicare supplement through us. There are gaps in their coverage, and that's what Wes and I, as we kind of go through this today, really want you guys to think of is that Medicare is amazing. It's coverage that, these folks are going to get if they have enough quarters and they sign up for it and all that good stuff with Social Security. But keep in mind as we're going through this that it does not cover everything. And that's why there's a need for recovery care choice, home care plus, cancer, heart attack, stroke, MASA. All of those programs really dovetail well into the whole Medicare picture or the medical insurance picture. And as we go through this, we're going to add that in to say, all right, think about cancer here, think about heart stroke here, think about home health care needs here. So I'm excited to to talk through this with all of you and Wes today. So let's hit it.
Yeah, and Chris, to add to it before we move to that first slide, there's really three types of agents out there. There's the first type of agent that will take a PowerPoint presentation like this, they'll do some research, they'll do some Googling, and they'll be an expert at Medicare and high five to you. But then they do the wrong thing, which is go into Mrs. Jones's house physically or virtually and overwhelm them with their Medicare knowledge because it makes them feel like an expert, right? And so that retiree goes from, I'm excited to sit down with this benefit representative to, wow, there's a lot of stuff going on. It's very confusing. And man, did they just give me a download. So one, don't be that agent. These retirees are already a little worried. They're already confused. And if you're dumping knowledge on them just to dump knowledge on them to prove that you know everything about Medicare and that you're an expert, it's not going to go in your favor. On the other end of the spectrum is I remember teaching a class a handful of years ago, and an agent was in it. We were in Austin, Texas, teaching this class in person, and we got to a portion of the meeting where it was kind of an open question, open dialogue type thing. And I said, if anybody has any question, throw your hands up. And so he threw his hands up and he said, hey, can you tell me what Medicare is? And I go, what do you mean? Because it was kind of a curious question. He'd been around for 2 years. And he goes, I always have retirees tell me that they have Medicare, but I don't know how to answer that when they say that. And I go, you've been here for 2 years and you hadn't Googled what the heck Medicare is? And so there's a fine line between you being the most ignorant person when it comes to Medicare, you being an over expert at Medicare. You want to be somewhere in the middle where you know what you're doing, what you're talking about. You're able to answer their questions and give them confidence, but you're not downloading everything that you know onto them and shortening how much bandwidth or brain width, as Chris and I just talked about a little bit earlier, that they have that they can devote to things like the products you're rolling out to them. So let's talk about Medicare. And who can get Medicare? Well, it's only for U.S. citizens and legal residents. And so for the most part, I'd say 99.9% of our clientele that we have here at AMBA, they fall into that. But you also must meet a couple of requirements. One, you have to be 65 years or older. If you're younger than 65, you have to have a qualifying disability, and that's a disability that lingers for a long portion of your life that would make you eligible for this. Or anyone with a really tough one, like a diagnosis of a end-stage renal disease or ALS, which, man, that's a brutal one to have. If you're one of those folks, you can be any age on the spectrum there and qualify for Medicare. So that fits most of our clients that are 65 years or older. Chris, how about when can we sign up?
All right, this is super important about when you sign up. So there's technically a 7-month, and a few states out there have even longer where you can sign up 6 months prior to your effective date. But there are 3 times when you can sign up for Medicare. So the initial enrollment period, if you're eligible for Medicare when you turn 65, meaning that you have the 40 quarters worked, and sometimes you'll run into, and people will know this because you'll run into teachers that maybe hadn't paid into Medicare just because of the way their district worked or the way their system worked, but they had summer jobs or part-time jobs, and they were doing that so they could get their Medicare quarters, so they'd be eligible for Medicare. So you can sign up during your initial enrollment period. It's 7 months. It begins 3 months for most states in general. before the month in which you turn 65, includes the month you turn 65, and then ends the 3 months after you turn 65. And so, again, I think Illinois still is 6 months prior. There might be a couple states out there that are 6 months prior. But whether it's 6 months or 3 months, just know that it starts with the 3 months. You want to make sure you sign up as early as possible, because I don't ever want to leave anything to chance about the government processing something in a timely manner. Right? That typically, doesn't happen all that often. So sign up early. Also, during this time, it's a guarantee issue. So when you enroll, no matter what kind of bumps, dings, dents, and bruises that you have, during this time, you can enroll and get approved. You do not have to meet any sort of health requirements, no health eligibility, and you don't have to worry about a build chart, like a height and a weight chart. So you can see there 3 months before you turn 65, 2 months, 1 month, the month you're 65, 1 month, 2 month, 3 months after there. So you can see kind of all that information. But just know, as folks are approaching 65, talk to them about it and have that bell go off in your head. If it's 3 months prior to their 65th birthday, that's the period that you really want to make sure that you help counsel them on signing up for Medicare.
And Chris, one of the things I'd say is when we look at our leads, they're provided with some birthdays on them. Know that if you're going to a house that's someone that is approaching their 65th birthday, even if there's someone that has enrolled, not enrolled, all that kind of good stuff, they are getting bombarded by a million different companies about, hey, it's that time. Hey, you're turning 65. Hey, you just turned 65. Hey, it's your initial enrollment period, or one of the other 3 times we're going to talk about. And so it's on their brain, even if it's not something they need. You need to be able to speak that language. And as Chris says, there are 3 times that you can enroll. The second time you can enroll is the general enrollment period. So if you don't sign up for Part A, and if you have to buy it, and or Part B when you're first eligible, and you don't qualify for the special enrollment period, you may have to also wait until the Medicare general enrollment period, which is January 1st through March 31st. And so these are the other 2 times that you can enroll in these programs. And so it's in the initial enrollment when it's a guaranteed issue, during the general enrollment, or in the Medicare general enrollment period. So you can see the time frames with that as well. All right. How can we enroll, Christopher?
All right. So beneficiaries, which means someone eligible and electing to receive Social Security, they're going to automatically be enrolled in Medicare Part A and Part B. I think somebody maybe just popped off of mute. Part A and Part B, the first day of the month, they turn 65. But not everybody takes Social Security at 65. And so some people take it at 62. Some people take it at 64. Kind of depends on when you're eligible to receive it. If you want to have a lowered amount or your full amount, 67. Some people wait till 67. So for those that elect to defer Social Security benefits, they do need to enroll themselves in Medicare through the Social Security Administration. Most people that I've talked to, what they've done is they've visited their local SSA, which is Social Security Administration office. Got through that without being tongue-tied. And so you can see there, you can go to the SSA website, ssa.gov. You can call the Social Security Administration. There's always going to be, a way for you to get in touch with them, whether it's on the website, whether it's through the phone. But again, in my, 13 years in the field and 19 years with AMBA and talking to folks, everybody that's had the best experience has gone, set an appointment, and done it in person to make sure, again, that it gets done and you don't leave anything for chance over the phone or online.
And you can set an appointment so you're not waiting in line and all that kind of great stuff. So let's talk about the cost if they do wait. If they're not in one of those windows that they're eligible to submit their applications and get approved for Medicare, and they're enrolling in that Part A and Point B, they will get a late penalty that is 10% of an increase on Part A and 10% of a Part B if they wait till outside those windows. So with as much stuff as they get bombarded with, they should know that, hey, something is going on in my life as they move through these windows. But two, if you do run across a retiree and they do not have that Medicare A, Medicare Part B, and they are in that 65-year-old window or outside that 65-year-old window, This is what we need to gently push them to go make sure that that's taken care of, just because we do not want to get them or have them saddled with a penalty of the premium for Part A and Part B.
Now, we do have a lot of folks that are still working, so I have had a lot of clients that, retired and went back to work, full time, or they have a spouse that's working and, they're on an employer based or, a major medical program that is through still a district or employer based. So, what if I'm still working and have health coverage through my employer, my spouse's employer? If I decline Part B, and decide to enroll later, are you going to have to pay a late enrollment penalty? So the answer is no, but it's as long as you're eligible for and enroll during that special enrollment period. You want to make sure that you let Social Security know, you make sure you have your Part A all taken care of. But if you wait to enroll in Part B because you're working, because you have a major medical group health plan through an employer, spouse's employer, through a union, something based on the current employment, you can enroll during that special enrollment period. You can sign up for Part B during one of these two times, which is down here. Anytime you're still covered by an employer or a union group health plan through your or your spouse's current or active employment. And then during the 8-month period that begins the month after the employer or union group plan coverage ends, or when the employment ends, whichever is first. So basically, what this is trying to tell you here is that if you are covered through an employer group plan, you do not have to sign up for Part B right then and there because you are covered. Once that employer group plan ends, whether it's because you're working and you retired, or it was through your spouse and they retired, then you want to make sure that I know there's this period here, 8 months, blah, 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 blah. Don't let anything wait or go to chance. You don't want to, be without coverage. Just make sure that they know, hey, as soon as your employment is going to end, make sure you get an appointment set up with the Social Security Administration and get signed up for Part B, period. Don't worry about time frames. People forget time frames. They get a different time in their head, and all of a sudden they miss something, that's important. Now they start paying a penalty. Just know I got coverage here through an employer plan. It's ending here. I need to sign up immediately afterward for Part B.
You got it. So what is Medicare? There are 4 parts, or I shouldn't say 4 parts. There's 4 different sections of this that we're going to discuss today. You've heard Chris and I throw around Part A, Part B, enroll in Part A, enroll in Part B, penalty for A, penalty for B. But what exactly is this that we're talking about? So Part A, when it comes to Medicare, is your hospital insurance. It's the hospital care, it's the nursing care, it's the home health care, all that kind of good stuff. And we'll break that down a little bit more in just a minute. Part B is the medical side of things. So when you go to the doctor's office, when you have physician visits, when you do outpatient services, that type of things that are not when you're going in for a 911 and you get checked into the hospital. Part C is the Medicare Advantage. You may have heard, or you may even be participating in some of the things that AMBA is doing with the Medicare Advantage program. That's Part C, but it's what A and B is together, and we'll go into a deep dive on that. And then Part D, I think we've all heard retirees looking for a Part D or looking for something to help cover their prescription drug coverages. That's called Part D. And so those are the 4 parts, and we'll do a quick deep dive on these 4 parts. So Part A, which is our hospital insurance.
All right. So for Part A, like Wes said, there's Part A, Part B, C, D. That's not to be confused, but often is with plan, like Plan G, Plan F, Plan, N. Keep that in mind. So there's different plans within a Medicare supplement, but Medicare has these different parts, Part A, B, C, D. And so Part A, like Wes was talking about, you just think about that. That is your hospital coverage, hospital stays, inpatient, surgeries. You can't be, as long as you have your 40 quarters worked and you're eligible, you cannot be denied for Part A coverage. So you can go to, that's not like an HMO, so you can see any qualified healthcare provider in the U.S. that participates and accepts Medicare program. And so most, when you, depending on where you live, you're typically going to have multiple options of who is in your area, that is accepting Medicare, and accepts Medicare, Part A, Part B, as your coverage. We'll get to this in a minute, but it's good to say now that Medicare supplement plans are all the same. So whether if Plan N is Plan N is Plan N. It doesn't matter if it's Nicole's or Kelsey's or Wes's or Chris's insurance company, or Aetna or Cigna or HealthSpring or you name it. Plan N is Plan N, Plan G is Plan G. So the only difference is if you have a different plan. And if it's a Medicare covered expense, your Medicare supplement is going to approve it. That's where some of the things come into play with MASA. And I'm not going to muddy the waters up too much right here, but with Medicare and a Medicare supplement, if it's a Medicare approved expense, your Medicare supplement is going to cover it. So if somebody asks you, will my Medicare supplement cover this? Mrs. Jones, is it a Medicare covered event through Part A and Part B? Is your doctor saying that Medicare is going to cover it? Yes, then your Medicare supplement is going to cover it as well.
Love it. So Chris mentioned some of these things, but some of those services that are covered is things like semi-private rooms, hospital meals, skilled nursing services, care and special unit, drugs, medical supplies, medical equipment used during inpatient is the key to that, lab tests, x-rays, medical equipment as inpatients, operating room, recovering room service, blood transfusions, skilled nursing facility in a hospital or skilled nursing facilities, inpatient, outpatient, rehabilitation services for qualified inpatient stays, part-time skilled care for homebound folks, hospice care for terminally ill, included in medications to manage symptoms and control pain. But the key is this is the hospital side, so it's inpatient. And I think where a lot of our retirees sometimes get confused on what's covering what is just because you're in a hospital doesn't mean that you're inpatient. Hospitals are getting very tricky with how they bill these days. And so you may be in an ER, you may be in a room in the ER, but they can keep you for hours and hours and hours and almost 24 hours, and that's still not considered inpatient. So Medicare A covers you for inpatient, and the hospital has to say that you are inpatient for that.
Yeah, and as Wes is going on to the next slide here, I'm going to chime in a little bit to what he was saying with inpatient. So all of you, you don't have to raise your hand, but all of you have hopefully heard of, observation status. It's a really big piece to why we sell recovery care or recovery care choice or home care plus, depending on, what you have in your territory. Observation status is becoming used more and more and more. Jamie Sarno, who you guys have met through many different presentations or whatnot, and who really was one of the major architects of the Recovery Care Choice program, has kind of made a name for himself for truly understanding this and helping companies and carriers like Aetna come up with a plan that then we can sell and provide to our retirees to protect against that observation status. So there are hospitals have different, reimbursements, and insurance carriers are going to look at what percentage of the individuals did you admit. If you have somebody that's in the ER or even stays overnight and is in observation status, they're not admitted, like Wes said, and that's why our Recovery Care Choice program and Recovery Care come into play and are so important for our members to have. So I'm not going to go into training about what observation status is or isn't. Just know that it exists out there. Google it, put it into Chat GPT, and kind of like we said at the beginning, we'll interject, why there's gaps in coverage, even though you may have Medicare Part A, B, etc. That's one of the major gaps is you have somebody being put in observation status and not actually being admitted. So with Medicare Part A, these are 2025 costs. So premium is $0 for most people. Like you heard me talk about, you have 40 quarters worked. You have 40 quarters of your lifetime where you've paid into Medicare through the tax that you see come out of your paycheck. So that's $0, for most people. If not, can you still get it? Yes, but you have to pay for it. So it's $518 per month if you paid Social Security taxes for less than 30 quarters. $285 per month if you paid Social Security taxes for 30 to 39 quarters. Deductible, $1,676 per benefit period. Copays for hospital stays, $0 for days 1 through 60. You can see down there $419, 61 to 90, $838 days 91 and beyond. Are those specific numbers something you need to have memorized? Absolutely not. But just know it's important that folks that have worked and have paid in those 40 quarters do have a $0 premium. That's again why you might meet a teacher or maybe somebody that earlier in their career had a choice to not pay in and didn't, but then realized what a bad move that was going to be later on in life and got a summer job, or a part-time job where they did end up paying into Social Security and Medicare. On the right there, you'll see copay for skilled nursing facility stays, $0 for days 1 through 20, $209.50 for days 21 through 50. And for hospice care, copay up to $5 for each prescription to manage symptoms and control pain, and then coinsurance up to 5% for inpatient respite care to give primary caregivers rest or time off. Are you ever going to have to recite all of these specific bullet points to Mr. and Mrs. Jones? You will not. All right. If you ever need to look it up, great. But this is what, when I say they're making an appointment, it's the Social Security Administration to get set up for Medicare Part A and then Part B, which Wes will talk about here in a second. That is what they're going to tell them. So it's good for you to have that knowledge as a base, but it's not something you're going to have to memorize and recite, to them word for word.
And one of the most important things, and a question that we get quite often is, well, I have Medicare Part A. Isn't that going to cover my skilled nursing care, Chris?
And it will not. All right. So you see there, it's $0 for days 1 through 20 if you have 3 consecutive nights in a hospital and then go into skilled nursing care. Let's say you meet that. Great. You have days 0 through 20, covered for your home health care, nursing home, assisted living, long-term care program. Wonderful. 20 days is a drop in the bucket, for a long-term care need. That also is why it's so important that when you're writing a recovery care, when I say recovery care, I just throw choice in there. So it's one less word for me to say. Or when you're writing RC choice, not a RC cola, when you're writing an RC choice, just make sure that your waiting period, or what we used to call an elimination period in the long-term care plans, write it at 0, right? 0 days. So then when they go on claim, even if they have these 20 days paid for, it doesn't matter because it starts at 0 days. There's no waiting period, no elimination period. So that's very important, I feel like, for your RC choice. Don't put a waiting period on there. They have to meet it every time they file a claim. And so just have it at 0. It doesn't increase the premiums by that much, and they will appreciate it when they actually go on claim.
Love it. I love it. And that's just something that you just do. It's an automatic thing. And when people tell you that they have it covered through Medicare, you can see right then, and you can even point, and we'll show you where you can point in a brochure here in a minute, exactly what their out-of-pocket is. So Medicare Part B, this is the part that is the medical insurance part of it. And it covers things like your outpatient care, your doctor services or visits, your home health care service, preventative care, limited outpatient prescription drug care, clinical research, durable medical equipment, kidney dialysis and supplies. I feel like I'm giving things away at a game show here. Chronic services, vaccinations, diabetic self-management training, mental health treatment, urgent and emergency care, ambulance service, welcome to Medicare and annual wellness exams, and other medically necessary services not covered in Part A. So these are the things that are outside being an inpatient at the health or the hospital. All right, Chris, how are we gonna pay for this? What's the cost of it that we have associated with Part B?
All right, so these are 2025 costs. Since we are just into 2026, these have been changed and updated. So just know that they're, of course, they didn't go down, right? Nothing with medical insurance goes up or goes down. So the premium is standard premium is $202.90, up from $185. So when you take a look at on here, it says your premium may be more than $202.90 now, but $185 if your reported income from the previous year basically was above $103,000 for individuals and $206,000 for couples. So every now and again, you're going to run into somebody and you say, hey, your Medicare Part B premium for 2026 is $202.90. And they're like, well, why am I getting charged more? It's because they made more money and they were considered highly compensated and crossed that threshold. So if you see anybody paying more, it's probably not a mischarge. It's just because of the fact that they made more money and they're in that higher income bracket. You may have the Part B premium deducted from your Social Security if you have enough, or paid directly to Medicare. I always say if you have enough, because we used to have to say that more before the windfall elimination provision was enacted. Many educators had very limited Social Security benefits because they called it double dipping. When that was eliminated by the government, which was a great thing, we had many of our educators get lump sum checks and get a much higher Social Security check, which is great to know. So now you know they have some more disposable income for talk about when it comes to our supplemental benefits. And the fact that they're going to have a higher Social Security check, so their Part B premiums can come right out of there. I know what I was going to say. Wes's mom was an educator, and she had a little extra money coming out, and she's like, I don't know what to do with this, And so if there's other teachers out there, I think Wes convinced her to give it to him. But if there's other teachers out there, that are in that boat, say, I know exactly what you can do with it, Mrs. Jones. We can cover your gaps. Real quick, Wes, deductible went from $257 to $283 for 2026. And then coinsurance, 20% of the Medicare approved amount for most covered services after you pay the deductible, which is why it's so important to have a Medicare supplement to pay for the 20% that A and B do not.
I'm also going to add, there's several times that Chris said things like, well, a retiree may be wondering why their premium is more, or they may be wondering how many quarters they meet. It is not your job, just so you know. It's not your job to figure all these things out, and we don't have it in a database here at AMBA, but you can point them to those Social Security offices, and that's the best thing you can do, just because you don't want to make a guess that's wrong. You don't want to tell them something that's incorrect, and you don't want to muddy the water more than we have to. I see Carrie has a question here. Just to confirm, Part B premium is in addition to your Medicare supplement, so you pay for both. And the answer to that is, Carrie, yes. Yes, that's exactly how it works. And the Medicare supplement is used to fill the holes of these co-payments and these deductibles and the things that are outside of the Medicare program, Part A and Part B. Okay. Leanne's Basic Otter says, this plant meeting is only good for 30 minutes. How can we update it? So, I love these AI things that people put on here, because I guarantee you, no one ever goes back and looks at this or reads this. No one ever does. Like, you didn't pay for a free Otter plan or for a subscription one to hear Chris and I drone on for an hour. And so I love seeing them all drop in the chat there. All right. Find out if you'll pay a higher Plan B premium in 2025. The rules kind of apply the same thing here, so you can look at this. Of course, if your income was higher, you're going to pay a little bit more for it. And so you could see on the left column, if they filed an individual tax return and how much they made. In the middle column, if they filed a joint tax return and that's how much they made together, or if they're filed married and separate tax return on that third column there, you can see that their premium goes up and up and up and up. With our retired teachers, this typically isn't an issue if it's just them or our retired state employees, unless they were the governor. They didn't see a huge dollar paycheck. But we do have a lot of retirees that we work with that had spouses that made really, really good money in their careers. And we'll see some of these premiums go a little bit higher. But again, if you see a retiree with a higher premium that questions it, point it back to the Social Security office. That's the best that we can do for those guys as well. Now, we're on to Medicare Part C, the elusive Medicare Advantage program that folks in AMBA really didn't know much about, and we didn't do much about it just a handful of years ago. And now we have probably 60, 70 people on our field sales support team, or our field team, out there helping people with Med Advantage plans each and every AEP season and OEP season. So, Chris, what's a Medicare Advantage program?
All right. So Medicare Advantage program is something great. I just want to say this real quick. We'll try it. I know Kelsey's probably keeping track of all these questions in there. Kevin, you asked a question. I just put the answer in there about COBRA, and does that extend the 8-month period. It does not. Cobra is not considered. The end of Cobra is not considered the end of an employer-based plan. It's truly when the employment ends. But we'll answer some of these in the chat, so keep looking for answers, or what we don't get to, we'll try to get to at the end as well. Cool. So Medicare Advantage, I think, is what we were talking about. I think Wes said, when he and I started here, neither one of us knew how to spell Medicare Advantage, because I don't know, we don't even know if it existed. And now, it's blown into a massive, part of our business here at AMBA. So we have learned a lot through Medicare Advantage. Devin and her whole group, and then others that are scattered throughout the country, have become amazing Medicare Advantage agents. So when it comes to coverage, later in life, meaning retirement, 65, etc., there's another way that you can have coverage other than Part A and Part B, and it's through a Medicare Part C Advantage plan. So there's quite a few different Medicare Advantage plans. Some require networks, some are PPOs, some are HMOs. They're plans that are offered by private insurance, so it's not Medicare through the government like Medicare Part A. So the plans are offered by private insurance companies approved by Medicare. Choices, coverage, and costs vary, and you must be enrolled in Part A and Part B to be eligible. So don't think that this takes you out of having to enroll in Part A and Part B, but it's basically like you have a private health insurance for your coverage, when you're 65 and retired. There are some differences, when it comes to, Medicare Advantage plans that you really want to make sure people understand, and that is open enrollment. Every time you see somebody, whoever is out there, like Joe Namath and Larry Elder and all some of these other, celebrities that are out there talking about don't miss open enrollment. Open enrollment is referring to Medicare Advantage plans and prescription drug plans, because there is a specific open enrollment for those plans. There is not for Medicare supplements. Medicare supplements you could change at any time as long as you can medically qualify, or if there's a special rule in your state like the birthday rule. And you or your FML will know if there's a birthday rule in your state for Medicare supplement. So just know that open enrollment doesn't apply to Medicare supplement. It does apply to Medicare Advantage. While it technically doesn't apply to Medicare supplement, man, is it a fantastic reason to call up all of your clients and talk to them about, hey, it's open enrollment again. Let's see where the gaps are in your coverage. Oh my gosh, you never signed up for that lump sum cancer policy. I'm glad I'm calling you during open enrollment. Let's get this started.
I love it. If you're working after age 65, do you still have to sign up for Part A, or can you wait without worrying about penalty like you can with Part B? Do you know that one off the top of your head, Chris?
You do have to sign up for Part A. So when you are turning 65, you want to make sure that you get signed up, for Part A.
Melissa said, how much they made, is that adjusted gross income or taxable income? It's taxable income is what that one's based off of. We answered the Cobra question. Whoop, that was there we go. Chris just posted something there with Cobra. And I think that's all the questions up to this point. Did I miss anybody's? I think we're good there. Oh, I see someone. Michael, you have your hand raised.
It's imperative, if you are a Medicare agent and you're a licensed Medicare agent in your state, and you're talking to people who are turning 65 who plan on working beyond that, that's okay, but they need to let the Social Security Administration know what's going on. They need to fill out a form on ssa.gov. That's how they will get their A, which is no charge. And in there, they will have a paragraph that they will let the government know, I'm still working and my medical coverage is through X. That way you won't get penalized. You just need to make sure you do that.
I love this. That's a man that sounds like an expert right there, Chris. What are we faking it for?
Right.
So thanks, Michael, on that. We really appreciate you speaking up.
You're welcome.
All right. Medicare Advantage is covered services. So what is covered? All benefits of Part A except the hospice care and Part B. Most Medicare Advantage plans cover cover prescription drug programs as well, and some Medicare Advantages plans may offer additional benefits. And what those additional benefits, they can be all kinds of things. The one I see that are the most popular ones out there are ones that try to add extra perks to get you to take this plan over that plan, because as Chris said earlier, some of this stuff is very standardized. So this one will throw in a free silver sneakers program where a retiree can get a gym membership for free and things like that. So you'll see some flashy things in there when it comes to these Medicare Advantage plans that try to get people to take this plan over that plan. All right, the cost, Chris.
All right, so Medicare Advantage 2025 costs, and let me say one last thing about that question about Part A. I would just go with what I said. If you technically read into the Medicare.gov guide, you can find some things in there where they really don't have to enroll when they turn 65 if they have employer group plan. But with some, because there's no cost to this, or typically no cost to this, especially for the people that have 40 quarters, just tell them to enroll, which is why sometimes when you see a Medicare card, you may see one date for Part A and a separate date for Part B, which is fine. But rather than forget about something, do something late, get yourself, in a situation that you don't need to get yourself into, just and you talk to your folks about Part A and enrolling at age 65, because again, it's free and it's not going to hurt anything, even if you're still on, an employer group plan. So I wanted to clarify that. Sometimes I'll give you that answer. It's right, but also to eliminate, any potential pitfalls down the road. So Medicare Advantage 2025 costs, so premiums, plan premiums, they can vary greatly and widely, and plans can change from year to year, like we were talking about with the open enrollment period. You do continue to pay your Part B premium to Medicare. Deductibles, so again, some plans are going to have deductibles while others don't. Some Medicare Advantage plans are even through their teacher retirement system. Like in Illinois, when I worked there, they had, Medicare Advantage. They had a plan that acted like a Medicare supplement. Then they switched to a Medicare Advantage plan. There's many in Ohio, as well, that have Medicare Advantage plans through their teacher retirement system. It's fine. Never pull them off of their retirement system benefit. Ever. If they tell you I have my insurance through my retirement system, say, great, absolutely, keep it. You did a fantastic job. Your association did a fantastic job. I am here to just help you with a few of the gaps that are left after that coverage. Even if you think it's cheaper, do not pull them off ever. You will get in big trouble from the executive director and AMBA. All right.
And I'll add one more, maybe a lawyer. Because once you get pulled off of that, at least in most states, if not all states, you can't get back into it. So once you drop it, you can't get back in it.
That's right. Plans, they can, they may charge deductibles for drug benefits over, just the cost varies. Kind of like I have my insurance through Liz's company. If I had my insurance through AMBA, there would be a different cost, a different deductible, a different copay. For different employer-based insurance companies. Same thing with Medicare Advantage. So copays, many plans charge copays for doctor visits, prescriptions. Again, the amounts are going to vary by plan, type of plan that you have. There's PPOs, there's HMOs, and coinsurance. Plans may set coinsurance terms for certain services. So cost during Part D coverage gap may apply. So just know, again, a Medicare Advantage plan works much closer to an employer group plan because there's different types, there's different copays, there's different deductibles across those plans, just like there are between employer group plans today.
All right, now we're going to talk about kind of what Chris alluded to earlier, Medicare supplement insurance. You'll hear people say, call it Medigap, that type of thing. These are your plan Ns, your plan Gs, all those kind of things that we have in our arsenal that we can help retirees out that may need that additional coverage. So Medicare supplements, they help pay the out-of-pocket costs that come along with Medicare. So if you remember back in the slides we talked about earlier, there was a copayment, there was a deductible, there was a hole where it wasn't covering this or it wasn't covering that, all that kind of great stuff. So all Medicare supplement plans are fully or partially pay for the Plan A hospital coinsurance, Part B coinsurance or copays, the cost of blood transfusions for those first 3 pints, 365 extra hospital days if something pops up, and then this question that Nancy asked earlier, hospice care coinsurance. That's where it comes from the Part A, and that's what the Medicare supplements start helping with. It does. Medicare supplement plans may also help pay for your Part A deductible, your Part B deductible, Part B excess charges, cost of foreign travel, emergency cares, up to plan limits, and Part A skilled nursing care facility coinsurance. And so that's the difference between all these different Medicare supplement programs, the Part N's, the Part G's, the Part F's, all that kind of great stuff. They all cover a little bit different compared to what the retirees need, may or may not be at the top.
All right. All right. No, thanks, Wes. And then there is a question about retiree system health insurance and coverage. If you're in a state that provides that, that does not go through AMBA. That doesn't go through, Chris, Wes. It doesn't go through any of our Medicare supplement
your brother Joe, ¿no te acuerdas?
Coverage, and it does not go through any of our Medicare Advantage agents as well. So if you are in a state where your association's members have access to a pension system Medicare plan or a retirement system Medicare Advantage, Medicare supplement plan, they're going to get that information from their pension system directly, not through anything that has to do with AMBA or an AMBA representative. All right, that was from Melissa. Great question, Melissa. Cool. So Medicare supplements, so premiums, insurance companies, they all set their own premiums, which is why you see some people have HealthSpring, some people have Aetna, some people have Mutual of Omaha. Plans that provide more coverage generally have higher premiums, like a Plan F and a G versus a Plan N. And then premiums may vary from insurer to insurer, even if the plans offer the exact same coverage, which is absolutely true. And premiums may change from year to year. Not may, they probably will, right? From year to year as well. So that's why we have a few different carriers that we work with when it comes to Medicare supplement plans.
And that's what Chris was saying earlier. If you have a plan in through Chris's insurance company or Wes's insurance company, it's exactly the same. The cost may be a little bit different, and the history of cost increases or premium increases also could be part of that too. So just because something is the cheaper plan doesn't mean it's not going to be the one that doesn't get the rate increases every single year going forward, where some of our more expensive plans or the ones that are a little bit higher, those are the ones whose rates oftentimes stay level for the course of the time that they have those plans. Next up is that fourth section of it, the Medicare Part D prescription drug coverages. And we hear retirees ask this all the time, where can I get this? What is this? How does this work? You can get drug coverage with the standalone Part D plan or as part of a Medicare Advantage program, which they call Part C on that. Some plans have pharmacy networks and mail order pharmacies that offer discounted prices. And so if you're working with someone, if you're one of those folks that are working with Med Advantage, you'll have access to a tool that you can put in the different things that Mrs. Jones is looking for or needs, and we can talk about what doctors are covered, what prescriptions are covered, and that helps decide which Med Advantage program that they may need. Plans are offered by private insurance companies approved by Medicare. Coverage, cost, and choices may vary from plan to plan, and you must be enrolled in a Part A and a Part B, just like Medicare Advantage, to be eligible for that Part D prescription drug plan.
All right, which Nancy Perlman, that's the answer to your question right there and what I just typed in there. So good question. Medicare Part D coverage. So all plans must cover a wide range of prescription drugs that people with Medicare take, including, most drugs in certain protected classes, like drugs to treat cancer or HIV or AIDS. A plan's list of covered drugs is usually called a formulary list. And then you're also going to see that many plans place drugs on different levels or tier. You'll see like a tier 1, tier 2, tier 3 drug on their formularies. So drugs in each tier have a different cost. For example, a drug in a lower tier will generally cost you less than a drug in a higher tier. And if you have somebody that is looking at comparing different prescription drug plans, You can do that on Medicare.gov. There's a really great calculator out there. Even Liz's parents got on there without me and found the best prescription Part D plan without my help, which I was really proud of them for doing that. So it's out there, and they can find that information out.
All right, drug coverage stages. So you can look through the fine print on all this, but Medicare drug plans and Med Advantage programs have drug coverages in 3 stages. The deductible stage, that is if your Medicare plan has a deductible and you pay out of pocket costs, and you've reached that full deductible. No Medicare drug plan may have a deductible more than $590, and some Medicare drug plans won't have a deductible at all. You've got your initial coverage stage. After you reach the full deductible, you're going to pay that 25% of the cost of the coinsurance for your generic and brand name drugs until you're out of pocket spending on covered Part D plan that reaches $2,000 for that one. And then you have your catastrophic coverage where you won't have to pay out of pocket for covered Part D drugs for the rest of the calendar year. So those are the 3 stages that you'll look for. Again, if you're in Med Advantage world, you'll have many tools at your disposal to help run their medications through that list and be able to pick out the best Med Advantage programs for them. All right, some
Awesome.
penalties.
Yes, penalties. So again, when it comes to penalties, some people may not realize there are penalties. Some people may. The best thing to do, again, is talk to the Social Security Administration 3 months prior to turning age 65 to make sure that every individual has the most updated information as possible. This is not something that you need to be, the expert on. This is something that you need to be aware of so you can direct your clients to the Social Security Administration. But specifically, the cost of waiting and penalties for Part D plans. So enroll in a prescription drug plan to avoid the penalties. You may pay a late fee or a penalty if you enroll after your initial enrollment period and there's been 63 days or more that you don't have credible coverage, like an employer plan, which again, that does delay a penalty and delay you having to enroll. You pay the penalty for as long as you have the coverage for the rest of your life. So if you miss one of these time frames and the penalty applies to you, it's not a one-time fee. It's a percentage, but it's a percentage forever. And it's small, but it's a small kind of stick in the side, that you're going to have to pay for as long as you're on this type of coverage. Penalty, it's calculated by multiplying 1% of national average premium by the number of uncovered months you were eligible but didn't have prescription drug coverage. Again, very specific information that you don't need to be the expert on. What you need to be the expert on is to advise all the folks that you're working with to say, hey, you are getting close to age 65. Have you set up your consultation with the Social Security Administration? Do you have coverage through your pension system, once you turn age 65? Who are you using for your Medicare supplement plan, et cetera? So you can counsel them on that so they don't miss anything and they don't have any penalties that they incur.
All right, coverage combinations and your options. And I think this answers some of the questions that we have bouncing around here about, wait a minute, they have a Med Advantage program, and so their hospice isn't covered, but they also have to have a Part A, all that kind of great stuff. So don't forget, when it comes to your coverage choices, you have to enroll in that Part A, Part B there. So that's the step 1, enroll in the original Medicare Part A and Part B. But then when we see some coverage options, this is what you see folks have out there while you're in the wild. So, they have either Part A or Part B, or they have Part A, Part B, plus a Part D for the prescription medications, or they have a Part A and a Part B and a Med Sup to fill in the gaps, all that kind of great stuff that they run into, or they have a Part A, a Part B, a Part D for the prescription medications, and a Med Sup. So you'll see many, many varieties of this with people that have the original Part A and Part B plans. Now, Chris, I know when we add that Med Advantage in there, all that kind of great stuff may change up a little bit. So what do they have?
Sure. So when you have a Medicare Advantage plan, again, that becomes your main insurance at that point. So your Part C, it's your Med Advantage. It's possible to get it without drug coverage, but most people, when they have a Medicare Advantage plan, they're signing up for a Medicare Advantage plan that is inclusive of a Part D drug plan. So you're going to find most people in that middle column. They have Part C Med Advantage plus Part D with a built-in drug coverage. You can get a standalone Part C. You can get a standalone Part D. So you can have a Medicare Advantage and then a separate Medicare or a separate drug plan Part D. But most cases fall into that center program because the Advantage plan is going to offer that option to you.
And Melissa, I believe that answers the question you just popped up there. And so you have the choice, but most people that we will work with will fall in that middle group that Chris was speaking about. Now, the key is the retiree and you, if you're working in the Med Sup world or if you're working in the Med Advantage world, is to find what works best for the client. You know, how often do they visit the doctor? How often is the frequency, and does it get costly? Are the medications that you regularly take covered? Do you have a particular doctor, hospital, or pharmacy that you want to use? Because we use that, had to look for that network and see what they take. Does your doctor accept Medicare assignment? Because some do, some don't. And that means you may have to change if you get this versus that. And do you have other health coverage through an employer, a union, a military, with the VA, all that kind of great stuff, or as Chris has been saying, through the Office of Group Benefits, through the state, through the pension, that type of stuff. And would you rather pay less in monthly premiums or pay less out of pocket when you receive your health care? So these are the things that we have to ask ourselves and help our retirees work their way through those plans when the time comes for what it is that they're looking for. And there's some additional resources. So Chris, which additional resources have you been screaming about the most? I think it's the one on the right.
Yes, absolutely, the one on the right. But the Medicare.gov is pretty cool too. There you can find that Medicare and You handbook out there. I don't remember what the page number is, but and I think you still can request one in print. At least you used to be able to. Okay. It's really good to get one in print because there's a section in there that will really help you sell massa. You know, when it talks about, is this truly an emergent medically necessary trip, you know, that the person took in the ambulance? And so there's a lot of ambiguous language in there about if Medicare is going to pay for an ambulance trip or how much of an ambulance trip they're going to pay for. So order one of those Medicare and You handbooks. It's only about 10,000 pages. No, I think it's about 100 pages long. But you can dig into that and you could probably get a PDF of it and do, you know, a control F and find, you know, the ambulance service on there. But these are all three great resources for you to take a look at. Medicare.gov for the first two, order the Medicare and You handbook, and then the Social Security Administration on the right there is going to be your best friend. And make sure that you have that information written down because, again, they are going to be the experts when it comes to signing up for Medicare Part A, Part B, and giving them some of that information that we went through today if they have questions on, I'm still on an employer group plan, you know, et cetera. Our biggest thing when it comes to everything that we went through today is for you to have, you know, a working knowledge of all this, but not to be the expert like you are on a recovery care choice or a cancer or massa plan, but for you to know, hey, the folks that are truly the expert on your intricate questions are the folks at the Social Security Administration. Unless you're Bonnie, who's been here for, you know, a long time and dealing with Medicare and Medicare supplement plans forever. We have some amazing experts here as well. But just know it'll take you a few years, you know, to get to that Bonnie level.
And I'll add one thing, that Medicare handbook, everyone on here should go on the Social Security Administration website and order that at Medicare.gov because it has so much good stuff in there. And yes, it is 100 pages. And yes, it can be boring, but there's nothing better than taking that highlighter and highlighting where it says they will not be able to cover this or they will not be able to cover that. And I see Michael's holding his version of it up. It'll give you a lot of great knowledge. And yes, Bonnie is correct. TRICARE acts like their Medicare supplement. So if someone is on the VA, TRICARE acts as their Medicare supplement, but that doesn't mean they don't need things like a long-term care insurance, recovery care, all that kind of great stuff, because they have deductibles. Even if they're using the VA home, they get put on wait lists. They have deductibles, that type of stuff as well. And so, you know, Chris and I would like to thank you. There's one thing I would like to leave you with, and we can answer any questions if anybody has, and if Chris has something to finish up as well. I know many of you took screenshots of this presentation, or you may go on SharePoint and grab this presentation as well. One of the things that Chris and I have been laughing about here lately, and maybe even crying about lately, is we've been asking agents for their presentations to see what we can tweak or make better, their PowerPoint presentations.